So like I said, we have a lot to get through today and a lot of people on this call. So I just want to establish a few ground rules. We have 5 panelists. You'll see they all have the gas background. They're each going to speak for 5 minutes. And then we're going to open it up for conversation for the last hour. If you have questions for the panelists while they're speaking, please put them in the chat and we'll try to get to them as soon as they're done. Please don't interrupt them. But then once the hour starts, where it's an open dialogue, feel free to continue putting comments, suggestions, ideas, things you'd like to see addressed in the chat. But it will be open for everybody. You're welcome to unmute yourself and join the conversation. Full disclosure, like I said, there's going to be probably 100 people on this call, so please be respectful of everyone's time. And if someone starts into a 15-minute soliloquy, don't be offended if I interrupt you and just say, you know, we've got to have time for everybody to chat. Don't be offended. Also, if somebody asks something that's off topic or starts to really take us off topic, I might also interrupt to just say, let's put that in a parking lot. And if there's a conversation that needs to be had around that topic, I'm sure GAS would be happy to organize another conversation. But there's plenty for us to talk about with this topic, so let's just try to stay on board. To get things started, we thought we would do a poll. So we're going to launch a poll. You can answer what concerns you the most about the next few months in terms of reopening. And we'll look at those results after the 5 panelists speak. So next up, I'd like to thank our 5 panelists for joining us and for sharing their perspectives. They're going to introduce themselves in turn and tell you about where they work. They're going to take 5 minutes. And like I said, please feel free to put any questions or comments for them in the chat. And first up is Brynn.
Hi, everybody. I'm Brynn Hurlson. I'm the Director of Operations at Public Glass in San Francisco. So Public is open right now in a limited capacity. We started on June 1st in accordance with San Francisco policies. And over about 3 weeks, we started letting renters into the studio across all of the mediums. In order to do this, obviously, we didn't just open the doors and say, come on in. So we have a pretty strict protocol surrounding how many people can be in the studio at any given time and what they can do while they're here, which I'll get into in a second. And then we've not started our classes yet at all in any sort of public way. We've aligned that with the reopening of gyms in San Francisco. You know, close physical proximity, strenuous, sweaty activity. That seems like a hot shop class to me. So the initial date for that was supposed to be August 15th, but San Francisco has paused reopening, and so our classes are not on track to resume anytime soon in the hot shop. In the warm and the flame shops, we can keep people masked and safely 6 feet apart, so we're more optimistic about when we'll be able to start those, but we haven't identified a date when we can resume yet. So barring any kind of dramatic shift, we think that here at Public, we are not going to resume hot shop classes or small team activities because team buildings were the majority of our income before this. So we won't be resuming those until the fall. And we don't think we'll be able to have any large team building activities or any in-person events until at least January. So we have altered the way people can be in our studio pretty much top to bottom. It starts the minute they get here. We only have 1 door that folks can come through, and they have to check themselves with a temperature self-certification station and write it down in a log. And then they have to demonstrate that they're masked before they're allowed in. And then once they get into the studios, we've limited that access as well. So in the hot shops, for instance, we have 4 benches normally. Now we have only 2. They're at the opposite ends of the studio. Same for the flameworking studio. We normally have 6 torches. Now we're down to 2 at the opposite ends of a long table. Both of those studios are being sanitized with isopropyl alcohol before and after every single slot, every rental. And then in the hot shop specifically, we've requested that anybody who's renting try to limit their blowing partnerships so that if someone should become ill, it reduces the spread throughout the studio as much as possible. So in casting and fusing and cold working, obviously those are pretty socially distanced to begin with. We normally don't have more than 1 person in those spaces at a time anyway, but we do have capacity-based limitations in place just in case. So we do have a core group of students right now that we are teaching in a way that we've modified for COVID. They would normally be in for one class session a week and then a practice session with a pair of them. And we've changed that. So it's a video lesson that their instructors are putting together and then placing on YouTube. And then they have a weekly Zoom chat where they go over those videos together. And then the instructors are in the hot shop during that time so they can demonstrate anything specific that the students have questions about. And then they can practice in those private sessions just the way they normally would have. So the biggest challenge in preparing to reopen our studio and how we're overcoming that challenge is probably going to sound pretty familiar to everybody, and that's bandwidth. Public Glass has scaled dramatically in the past 3 years, and we've added a bunch of staff in order to do that. And after COVID, we had to cut the staff in half. So there are now 4 of us managing an expanded business model, right? So we have to kind of thoroughly reimagine the way that we're going to run this business with no time and no money to do so. And the things that COVID add to the table, the extensive protocol that changes, day to day sometimes, and the communication that requires, and then the accommodation of people's comfort levels and their concerns, which is the most important thing we can do in a public space. All of that just takes time. So we should really be here about 80 hours a week in order to accomplish everything that we're meant to be doing. But I think that, it's pretty dire, but the community aspect of glassmaking is really what gives me hope, and the versatility that we have as artists. We're all asked when we're creating to change what we're doing at a moment's notice and respond to the situation in front of us in order to reach a goal. That goes double for nonprofit studios and independent studios, especially. And so, like the executive director of Public Glass and I have been here for 7 or 8 years, and this is not our first crisis at all, but we have a really good staff and a really good community around us. And I'm hoping that that sounds familiar to everybody out there, because I do think that that's how we get through this. And this open line of communication is why I'm here right now, because I think that if we can keep it open and talk to one another, and I can answer any questions for you and you can answer any questions for me, then we can learn from each other's successes and failures and figure this out together. So I'm just really happy to be here to have the opportunity.
My name is Brian Kibler. I'm the Director of Operations at UrbanGlass in Brooklyn, New York. Similar to what Brynn was saying, we opened about 6 weeks ago with our rental program. At this point, we do not have any public programming. So that means there's no education, there's no visiting artists, anything, even private lessons are still not on board. We followed basically New York City guidelines and New York State guidelines. So when the city felt they met the criteria to protect the public health, we opened in phase 1 under manufacturing, because the people who use our studio are basically small industrial manufacturers. We went right into shutdown and went into remote work right away. We kept all of our employees on payroll, and we used all of them quite heavily during the shutdown. We basically right away started looking at all the studios and thinking about all the areas. At that point, we were calling touch points, because we thought COVID was more of a surface to surface kind of disease. We looked at disinfecting, we looked at hygiene and distancing. It was 3 major concepts that we really wanted to kind of understand. So everyone, basically we just subdivided the studio into different shops, and everybody took their individual shops and looked at what those touch points were. And then we kind of regrouped. So we all came back with a lot of different information and things we were reading at the time. Like Brynn was saying, and it still happens today, the science is changing every day, so that makes it kind of hard. But we realized that urban had a responsibility, and so we went with the disinfection, using EPA standards. Basically, came up with a disinfecting schedule that's just hard to imagine, because it's on top of the techs running the studio every day. Now they have probably about 6 hours worth of disinfecting to do. We also looked at community measures. Again, hygiene, we put in place a lot of new safety protocols. Like I was saying, it's like the second you step in the door. As you can see, I'm working today, I'm in the studio, and I'm wearing a mask. The mask is on all the time in every shop here. It's just, we're finding that that's probably one of our best solutions at this point. And it's strange because a lot of the things that I've been reading about COVID, it's such an easy disease to kill. Soap and water, masks, alcohol. It's amazing that we're at this point. We also had a lot of expectations from our renters. So we have signage everywhere in the studio, basically kind of compartmentalizing each studio, compartmentalizing each part of the studio so that signs are easy to read and make sense. We also changed our studio access. Typically, we were open from 9 a.m. to 9 p.m. and you could rent whatever time you wanted. I decided to go with more rental time slots, just so that I could serve a larger number of people by doing time slots. But at the same point, at any given point of the day, any hour, we were limited to about 20 people in our space, which sounds like a lot of people, but we have a 20,000 square foot studio here. So 20 people is really not a lot of people for us. The other thing we asked of everybody is cooperation, which we thought might be a challenge. Glass blowers are not always the most cooperative people. But so far it's been interesting. We are such a small community and we understand that even people on the West Coast can affect what we do here. So I think it kind of really brought everybody together at this time. We also, at this point, ask all of our renters who, if they test positive, that they actually tell us so that we can inform our community what's going on and give everybody the chance to, step up their self-checks and make sure that we actually aren't spreading the disease. And it's interesting when we talk about challenges, I kind of think about it and it's sort of jokingly, it's like, if you think something isn't a challenge right now, you better step back and look at it because it's probably something you're missing. It's like everything's a challenge right now. And I think for me, especially, it's keeping everything a priority. It's sort of like Brynn was just saying, it's like in normal times, we prioritize things. Nothing can be prioritized right now. Everything is priority. It's from the, the goals of, keeping track of the science, keeping track of what the government's doing, the finances. How do you make this sustainable? A lot of us at this point realize what we're doing now isn't sustainable. It even comes down to mental health of your community, of your staff. My colleagues in development are working tirelessly, not only on emergency grants for this year, but trying to get grants for next year. My colleagues in EDU and education, they're right now reimagining their entire program. How do you do this virtually? How do you do this safely? How do you do this, without, having the comfort level of the people coming in at the top of your list? My colleagues in the studio, like I said earlier, right now are again working tirelessly. It's like with the added disinfection routine, just keeping the studio equipment running, plus also doing all that. So again, it's the challenges are just sometimes unsurmountable. Like you said, it's like 80 hours is nothing at this point. The other hard part about all of it is understanding what the next step is. We focused on opening, and now we're open, and the next step is, okay, making it sustainable, getting more people back. Like, what is the next step? Because I don't think the next step is normal just yet. There's lots of steps in between, and those steps are not just clear yet to everyone here. And like Brynn was saying, it's like, how do you make that happen? Well, you work harder, you work smarter, and you work together, and that's what I'm hoping comes out of this.
Thanks, Brian. Jiyong, you're up.
Hi, can you hear me? All right. So my name is Jiyong. I teach at Southern Illinois University, Carbondale. Been been here, this is my 15th year, something like that. And I think I have, I've been working on this studio rule last few weeks, and I think we have a lot of similar things, with the CDC, WHO guidelines and all that. And we already have so many rules around the studio, but I think the most important thing I like to focus on is the student not losing the studio access, because I think the glass is not really safe material to work with in our living space. It's hard to do any cold working, hot shop work, glass blowing is impossible. All the grits and, like whatever the hazardous powders and, mold making material, I think it's really difficult to work with. For the short term, I think it's okay. We can come up with alternative projects. But what I really like to do is not losing my student studio access. So I'm trying to replan my class. So during the class time, maybe the student can spend more time doing their work. In the past, I spent more time doing presentations and discussion sessions, but I like to have the student work during the class time so they can actually maximize the studio access doing their own work. Instead of in the past, they do most of their work outside of the class time. So I think that's one thing that I can change. My perspectives are based on mostly dealing with the graduate students because I had more graduate students than me teaching the undergrad students. So I think things can be a little different from someone who teaches a lot of undergrad students or work with like other public renters. And I'm in Carbondale. We're a small college town setting and pretty low density population. And our students, all the people can commute to the university campus with keeping social physical distance pretty easily. I'm planning this semester with less face-to-face contact. It will be face-to-face classes, but I like to have the student work on their work more than having the face-to-face. If there's any discussion sessions, we will meet somewhere either outside or a bigger space, or maybe occasionally we can do Zoom. So we just try to minimize the contact. There's lots of small things that I don't know. It's kind of have to see as we go. But everybody have to wear a mask in the building, minimize and close direct contact between the people and keep the physical distance. Hot shop is pretty challenging to do, but normally we have two furnaces running with the 2 benches. I'm planning to do just 1 bench and with the 1 furnace on. And there's eliminate all the share tools and distribute the tools to the individual students so they don't mix up. And limiting visitors. Normally we have, being on the university campus, it's nice to have all the people come, visiting each other's studio, but I think maybe this is not the best time to doing that. So we will limit the visitors. Each room has reduced maximum occupancy. So each door will have the sign with all those rules. I think that those are pretty common. Personal hygiene, like washing hands, limiting social activities. I think that's challenging. I think I talked about this last time when we were on other Zoom meeting, and I think for me, I think I can come up with some rules to set the rules so that our shops are pretty safe. probably safer than some grocery stores, and there are lots of other people being around. But I think the active participation of the student members, they limit their social activities after class. I think that's very important. But although we can say so much about their personal life, so I think that will be a big challenge. All the areas have a login book, so we can do either contact tracing, or at least we keep the record of who been in the space. Also, I've been recommending my students to have just one blower partner, so they're not mixing up the partners. And also, I think that's pretty common. I think that everybody's already doing a similar thing. It seemed like I don't have a lot of kind of special thing, I think it's a usual thing, following the university, and because we're a state university, we have to also follow the Illinois state, the guideline as well. So I'm working with them. Thank you.
Hi, everybody. My name is Jens Pfeifer. I'm the head of department at the Rietveld Academy at the Large Glass department. The glass studio at the Rietveld Academy was closed in March, quite abruptly when things began getting scary. All the public buildings and institutions were shut down. And after more than 3 months, we reopened the studio, but just for our graduate students so that they can work. Also in the workshop with limited access, with limited possibilities, but at least to give them some kind of access to the possibilities to the workshop. The graduation show is postponed until end of August. Usually it is in the beginning of July. And hopefully that buys us time, but we don't know how the COVID situation will change. At the moment, people are quite laid back about it, which causes new infections. So it's a slight raise here in the Netherlands, but we'll have to see how far that gets and how bad that gets. The Academy has a break now. We had to work like 3 more weeks into the vacation, and we will have to come back before the end of the vacation to guide the students, to come up with new rules, see the guidelines, and see what has changed and how we can apply the new restrictions. In the past, or in the last weeks of August, students will prepare for their graduation, and in September we're hoping to open the studio and the academy for all students again, but we'll go on a 50% rule, which means that only 50% of all students, staff, facility members can be on campus. This is due to regulations that come from public transport. This way they want to lower the amount of people in public transport, as this is one of the major places where infections can be gained. But there are so many different questions and opinions about this. Also, there's a big discussion in the Netherlands on what the best approach is. For example, we don't wear masks as one of the only countries, I think, in Europe. So this is quite different to other countries, other situations. If we can allow access to the studio, it will be students at a time. I think this is a normal rule. This is what everybody else also says. Small teams, 2 people per session, 2 hours per session, maybe more. No further traffic in the studio, no public in the studio, cleaning the tools before and after every session. And we have to see what the best measures are for that. We will probably wear masks because personally I think it does help, but this is, we have to see how students react on this. We see that young people are quite reluctant in precautions, so we have to see how this works out. We're thinking of making special mouthpieces for the pipes so that even if you only have one partner, you don't have to share the pipe. We have full air circulation, and for the rest, it's only glass blowing on appointment. Usually we have a free and open studio. People come in, sign in, or they just go and work wherever they like. Now that we have to restrict quite a bit. And that is also a challenge for us, opposed to giving the students the responsibility and the freedom to design their study, their day. We have to now come up with slots and rules so that they can or must work at a specific time. It's not only a challenge, it's also a concern, because this is very much about the experience of your study, and that's what like my biggest concern is. Also, the students, some of the students, feel that or wonder whether studying now is the right thing to do. Some people go on a break. Some people don't even want to start because they think they don't get the education they signed in for. And we have to make sure that we can at least give them all the classes, which we can do, luckily, because we're a rather small department. We have 15 students in total. But the limitation is in the free use of space. And I think this is what we will run against when we open up again. And I hope that, yeah, also what's been said before, you have to really rely on the team spirit of your students or your partners, so people work together and care about each other. And I think that will help. In general, I'm quite optimistic because we can provide the full curriculum. And I think, and I hope, students will come back and we'll make the best of it. And yeah, that's it so far from me. Thank you.
So that leaves me. Hi, everyone. My name is Anjali Srinvasan. I am the program coordinator for Glass and also a professor in the Fine Arts 3D department of the Massachusetts College of Art and Design, which is based out of Boston. We are the opposite of Jiyong. We are totally expecting this to spiral up when fall starts and all the students come back to the city. It is not like naturally socially isolated. We're absolutely, that's like, think of contingency plans. If you have to go 100% remote, is a very real scenario we're preparing ourselves for. But I thought I would tell you a little bit about the things we're doing to alter the way students work in our studios. I want us to think of it in like tiers. So there's college-wide guidelines or things that the college is implementing based on state regulations. And then there's my department's guidelines, people working in glass, what we are planning on doing that are specific to our practice. And then within that, we have another tier of guidelines for each class. And that's how we're presenting it to students. Like, you need to follow through with all three of these. So for example, we support about 50 students, elective and major, undergraduate for the most part. And our biggest thing is let's de-densify our spaces, let's stagger traffic. So right now we've brought it down to a traffic of about 15 people a day through our measures. For example, 60% of our classes are remote, only 40% are hybrid. And even within hybrid, that involves a balance between content that can be given remotely and stuff that you really need the studio for. So for example, a couple of weeks ago, we decided, my program was offering 7 courses. 3 of them are remote, 2 of them have been canceled, and I think 3 of them are hybrid. So that is basically like hot working, casting, flame working, things that you need the studio's resources for. So that's the first thing we've done, is just eliminate all the stuff that pedagogically and logistically you don't have to house in school right now. Apart from that, there are college-wide guidelines that all of you have spoken about, apps that students have to self-check every day. My school has teamed up with the Broad Institute. So if a student does not check everything and is like an orange light before they enter the school, they will get directed to a health coordinator who then gets a molecular testing done from the Broad Institute. They're quarantined for 24 hours while waiting for that test result to come. And then a future is seen, like, you know, they've got that protocol going. So I think the university takes care of that for me. That's sort of what happens if someone is infected situation. So we're focusing mostly in my program on how students are getting access. So for example, we're staggering exits and entries. Every studio is accessible only on a scheduled basis. So whereas all 50 of my students could access the cold shop whenever they want to, now they will actually have to choose between 4 hours in the morning or 4 hours in the evening. Pick your day. You can do it on a weekly basis, but that's when you can use the cold shop, which is very similar to when you would rent time at Urban every week or in the real world. So we're presenting students is you're going to change your habits, but it's very much in tune with what you would do if you had a day job and you were trying to be an emerging artist 2 years from now. So work with that right now. And right now they're sort of hesitant, but they seem to be on board because they still get the time. They recognize that even if they had 60 hours to choose from, they still only spend 4 hours in the cold shop. So me asking them to schedule those 4 hours is a change in habit, not diminishing access. I think that's been a critical challenge for us to communicate that to students. We're limiting people in space based on airflow studies that the school is doing. My school's been really great and hardcore about sterilizing spaces with everything ranging from fogging machines to UV wands to like a whole range of stuff they've got going. Every day, like from 1:30 p.m. to 5 p.m., the glass studios will not work. So we have one chunk of work time in the morning and one chunk of work time from 5 to 9 p.m., which is great because we get the middle of the day is gone. When students are attending other classes, we're able to sterilize the whole place. And then of course, there's like, you know, when you come to your blow swab, this is what you do. You wipe everything down with alcohol. I was telling someone before this panel started, we're sort of color coding all our pipes. For students who can't afford to buy their own tools, color coding them. Our tech has been dry heat treating them. So every bench, 2 benches, will get their set of tools, their set of pipes that only they will use. All students are required to wear a mask, which has a mask attachment for a blow hose. Each person needs their own blow hose. I want to give a shout out to Amy Lemaire for coming up with that open source design that you can get 3D printed for the mask attachment. We've been looking into the Corning Museum's foot pedal automated alternate inflation device. So we're looking at all these options, but I think the biggest thing is we're just trying to reduce the number of people, make sure everyone still has time, and classes are running on a staggered basis. So we're sort of alternate week in person, alternate week remote. And then that way never are there more than 15 people in like the entire floor. Like I said, for me, the challenge is basically how do I help students see that their education is not necessarily compromised from all of this. We're going to have to change habits. We're going to figure out other ways to do this, but they are going to emerge with a different set of skills that will be very useful. And also, I mean, I live in Boston, so equity and racial bias is a huge part of all this. So we are trying to figure out, well, how do we keep equity and access, you know, like we want to? How can students with, say, hearing or speech disabilities also still be able to see their instructor, hear their instructor, have access to all the learning tools they would normally? That's again something we're working with. But yeah, I think that's, and we're giving everyone supply kits for classes that can use supply kits. Like if it's wax working, we're giving them crock pots with wax, showing them how to set up a station at home. So then after they graduate, they're gonna have to work out of home. They know how to do it. So we're doing it.
Thanks. Well, I think there's a lot of really great information in there. And I think some of the questions in the chat kind of got answered as people were talking, which I figured would happen. But there were definitely several questions about mask wearing. of the panelists that spoke, who is requiring mask wearing even while blowing glass? Urban is, okay, not public. So you're basically trusting the pods, you know, that when they're blowing glass, they're allowed to take their mask off, but in other areas of the building, they must be worn.
Right,
Okay.
only 4 people at a time on the hot shop floor at opposite ends of the room. And the second they set foot off of what, you know, the line that's caused by the benches at the back, then they have to be masked. And
Yeah.
then within those groups, people are making their own choices. You know, some people do continue to wear masks, but we're not requiring it.
That's the same thing Pittsburgh Glass Center is doing. So it sounds like there's a mixed approach there. Jiyong, did you want to say something?
Yeah, so what I'm planning to do with the student in the hot shop, they have to sanitize, disinfect the pipe before they use. And once they, in case the other device is not working out for their work, then they have to have one designated blower so they don't mix up blowing. I think while I was thinking about that, then, you know, they're sometimes, you know, they cap the pipe and then, you know, kind of they're touching it. And then, so they have to make sure that they don't touch their face with a hand, you know, just like getting the germ on the hand necessarily doesn't make the people sick, but if they accidentally touch the face, that's the thing. So the people have to wear a mask. I'm actually asking my people to wear face shield because they have to, their face have to be so close. And if they're paddling or like turning pipe together, their proximity is very close. So I actually like to have them wear face shield over with their mask on.
Yeah. Another question that came up in the chat was how many folks, I'm guessing it's probably going to be all of you, have modified agreements? I'm sure everyone had a rental agreement or other class agreement. How many of you added COVID language to that agreement that are now having everybody sign? Yeah, same thing with Pittsburgh Glass Center. So I think that's pretty universal. I know in other conversations I've been in, there has been some sensitivity to being able to share those among, I think everyone's legal team kind of said, don't do that, you could be potentially held liable. But I think that everybody has definitely modified rental releases. Anytime you come into the building, you agree to do all these things from mask wearing to distancing and everything in between. Another maybe slightly more complicated question that came up was, what's the protocol in case someone tests positive? Can somebody on the panel address that?
I can just say that, you know, the log that we're using is a record that we, you know, no one has tested positive so far. But by keeping that log, we're able to contact anybody who's been in the space within a few days of that other person. And then, you know, if anybody comes in with a temperature, they have to leave immediately and then call the office. We discussed whether or not they're even allowed to get closer to the office in that moment and tell us in person. You know, is the speed with which they tell us or the distance from which they tell us more important?
It's very much based on trust that you really need your students to be honest about their health. We think they are, and because we have to have appointments or do appointments only, we know who's been in the studio. And so if somebody really got sick, we can warn everybody else, and probably the whole studio and maybe the whole academy would be shut down immediately if something like that would happen. Pretty sure.
Yeah. Another great, oh, go ahead, Jiyong.
Yeah, I think that generally, if someone confirmed that they have the COVID-19, then we have to do contact tracing, and you know that includes everybody who had a direct close contact, and trace back to like prior 48 hours before they have the symptom. So we have to, you know, the students maybe just in the glass studio, but you know they're taking other classes as well. It's like, you know, some lectures and, you know, other studio classes around the campus. So I think we have to work with other areas, and like we have to kind of see all the logbook where the student have been.
Yeah.
Yeah, and I think also just, sorry to interrupt, but it's like just asking, I mean, we have a rental community that's not our employees. So, I mean, we requested that they actually tell us when they get a positive test. I mean, they don't have to, but like Jim was saying, you hope for everybody to do the right thing.
Yeah. There was a question about shutting down for 2 weeks. I think that probably depends on where you're located. I know certainly in Pennsylvania, you know, if we were to find out that there had been a case in our building, it would not require a 2-week shutdown of our facility, but it would require a temporary shutdown, a deep cleaning, going through the logs, making sure once there's been a case in the building, all staff have to have temperature checks every day. So there's some additional procedures that have to go into place, but we would, for us anyway, would not involve shutting down for an entire 2-week quarantine period. Another great question that came up was asking how people are handling everybody touching, opening the furnace door, if you've got a couple of teams working, or are you limiting it so that only one team at a time is using the furnace?
I think, Jen, you had asked that question. One thing that we talked about, we haven't done it yet because the renters in our studio came up with their own way of doing it, was actually making a tool that's at every bench that you can sterilize, so that tool stays with that blower. And the tool is actually what's touching the furnace door. It came down to our community decided to use basically mitts or rags, so they were not actually touching anything on the furnace.
Great, thanks. I think I just wanted to make sure that everybody saw that Mary Kay from Bullseye put a resource in the chat about being willing to share online videos and instructional information, and also that into the chat went the link for the mask, the 3D mask, printed mask edition for the blow tube. So I just want to make sure that everybody was aware of that. Definitely there were some questions about whether or not people had been trying out any of the new alternate inflation devices. I know we've tested out some that we've built at PGC. You know, they've worked surprisingly well. So I don't know if anybody else wants to talk about that.
I feel a little bit tricky about talking about this because I know that there are a bunch of different things that have been invented across the community to kind of add an extra piece onto a blowpipe. And we understand them, and we do think that it has the potential to be helpful. But my biggest concern is that it gives the sense of safety while actually not providing a lot more safety. Because the breath is the problem, right? And especially since we're blowing into the pipe and then it's hot at the end and then it blows back through the pipe potentially, you know, putting about an inch more space in front of your mouth doesn't actually change that much in terms of particulate exchange. So I think that things that like auto inflators definitely change the situation, but I think that those add-on tips, we're personally not recommending them. We're not prohibiting them, but we're not recommending them. We've got isopropyl alcohol at every bench so that people are, you know, wiping off the mouthpiece between blowers. And we talked to an infectious disease specialist about the idea of sanitizing the inside of the pipe. I saw that come up in the chat. And so I volunteered to test out putting isopropyl alcohol down a pipe while there was glass on it, which was not as dangerous as I expected, but we tried everything. And in between, as long as you, like in between sessions, not in between exchanges, as long as you put the isopropyl alcohol in there and then blow it all the way out and give it a chance to dry, and you use 99% so the water doesn't allow it to circulate, it'll sanitize and not, you know, do anything else except maybe turn the inside of your glass black. And again, that's if you let it dry in between. I have no intention of telling the world to put alcohol in their blowpipe. Public Glass does not endorse that decision.
Thanks, Brynn. Yeah, that was one of the other hot topics, and something actually the panelists were talking about before we even jumped on this call was the different ways that people were using to sanitize the inside of the blowpipes. So if somebody else wants to jump in, that'd be great.
So I can tell you what we're doing. I think I mentioned it earlier. We're heat treating our pipes at, I want to say 350 Fahrenheit for 4 hours. And Brandy, I'm happy to email you the link to the NIH article that talks about that as a perfectly valid way to disinfect things in COVID. And we spoke with a public health person who was like, yeah, that seems pretty good. But again, I haven't actually gone to a lab and seen if there's virus on it or not. But everyone's like, yeah, 4 hours, 350 Fahrenheit, dry heat, kilns, great. So that seems to be something we are thinking of.
Brian, did you have a different method you guys were using at Urban?
Similar to what Anjali was just saying, it's we were putting pipes in annealers and bringing them up to that temperature. It takes a little longer because it's not dry heat, but that's the idea. We have annealers, our pipes will fit in. So if we have a class, when we get to classes, at least we can know that pipes are sterilized before the class uses them. And again, if we mark them and each person has an individual pipe and they're not sharing them, then that should be at that point safe. Again, the hard part is if you don't have a virologist on staff or industrial hygienist, being safe is just a comfort level.
Yeah, I just want to be clear too, because I know this, somebody just asked the question, how do blowpipe grips survive? So there are some blowpipes that have plastic elements, and there are some blowpipes that are just totally steel. And the ones that we're talking about putting in annealers or other heating chambers are the ones that are just completely steel, do not have any sort of plastic grip on them. I know another method that's been used has been sending steam through the pipes, which has its own potential dangers if someone were to grab a pipe after it had been steam cleaned and didn't realize that it was hot. But that is another way of effectively kind of cleaning the inside of a pipe by using steam. Another thing I just wanted to address really quickly was there was a question about organizations doing contact tracing. And unless an organization, team members have been trained in contact tracing, I don't think that anybody on this panel was suggesting that they themselves are doing contact tracing. I think they were suggesting that they are keeping a log so that when they're notified that someone that was in their building had a case, they could provide the names to their health department or whatever organization is doing contact tracing of people who might have been in close contact with that person, so that the trained professionals can reach out and do that contact tracing. That's not something that an organization is expected or responsible to do. So just wanted to be really clear about that. Another question came up about waivers. We kind of talked about students signing waivers. I've seen lots of information out there from lawyers and everyone else about, having somebody sign a thing that basically says, if you get COVID while you're in our building, it's not our responsibility. I think probably lots of folks are having people sign pieces of paper like that. And I think the legality or how much they will stand up in court time will tell. But, an organization, I think more importantly is the organization going through the steps of doing everything in their power to make sure that that doesn't happen. But I don't know if anybody else wants to speak to waivers or what kind of waivers folks are having people sign.
Yeah, I think you just said it. You, as an institution or a glass facility, you have to step up and make sure that you're backing up that waiver by being as safe as possible and proving to somebody that you're being as safe as possible.
It looks like somebody asked the question. I know lots of us have spoken with medical professionals that happen to be glass blowers, are in our spheres of influence and things. Somebody asked the question of how much does the heat of working with glass reduce the risks involved with COVID? And I don't know that that's a question that anybody on this panel can explicitly answer. I think as both Brynn, Brian, and everyone mentioned, like, the science is changing pretty quickly. And since none of us are virologists, but certainly it seems reasonable. I think the things that glass has going in its favor are the heat and the major ventilation in all of our studios. There's definitely been a lot of evidence that the way that ventilation flows across people is very important. So if you're working in a studio where ventilation is blowing across a bunch of different people, that's problematic versus working in a studio where the ventilation pulls away from people and straight out. So that's something we've definitely been talking about at our studio a lot. I don't know if anybody else has thoughts on the heat related to COVID and glassmaking.
We also have a lot of UV light, but again,
It sounds like several people want more information about the annealing process. Is anyone willing to sanitize pipes? Is anyone willing to share either what they're doing in the chat or as a resource that we could send out afterwards?
I'll send you the link. I'm just trying to find it in my heap of emails, but I have it because we did stuff with it. So I'll be sure to send it. Absolutely.
Okay. People are asking questions about how many people allowing assistance. Again, it sounds like pretty much teams of 2 only. Is anybody allowing larger teams of people to work right now?
Normally, we will have just one assistant, but if any student need more than one assistant, then they have to basically propose to me, get approval, and then make sure that, I will make sure that they wear all the personal protection equipment and be safe. The one thing we didn't talk about is a lot of shops have the Kibler mittens that they load to a kneeler. I think that people should have their personal layer of gloves, so they're not putting their hands on all in the same cavity of the gloves.
That also works. For example, we have a sandblaster, so we have arm sleeves that everybody can wear and gloves.
Yeah. A good question in the chat too was asking about plexiglass or other barriers between flame working stations, neon torches, workstations in the kiln shop. For Pittsburgh Glass Center, I know we have added plexiglass stations in our front reception area and in our kind of checkout areas, but not necessarily in the studios because of reduced capacity in those rooms and ventilation and not wanting to interfere with the ventilation systems. But again, anybody else have different thoughts on that?
I mean, you can also just do a simple smoke test to see where your air is flowing. One thing I was really surprised at, like I said, for my team, it's like every day we're like looking at new problems. Even though we thought about this the entire shutdown, I walked into the flame studio the other day, and I'm looking at a torch. And granted, everybody has a mask on there, but you're sitting behind a torch that's a velocity. It's just taking air around it and shooting it across the studio. Fortunately for us, it shoots it to a place where I have a ventilation system, portable ventilation system. But we did a smoke test, and it's basically I watch smoke shoot 6 feet, 7 feet into basically another person's bench.
I think that's one of the biggest challenges. I mean, ventilation can be a super positive thing, and it can be a real challenge because if you have a really strong ventilation system that is sending air 15 feet across the room, 20 feet across the room, a 6 feet social distance is not going to help, and so that I think is a really important thing, is the idea of doing a smoke test and seeing where is your air flowing in each of your studios and how do you protect people so that you're not putting them in direct kind of flow, even if it is 10 feet away from someone who might be infected. Somebody else asked the question about if it's deemed okay to teach classes, if your state regulations say, you're allowed to come back. Brynn, let's say that gyms open up in San Francisco and you decide, you're going to start teaching classes, but you have instructors that are unwilling to come back or are worried. How are people handling that?
I think, as most COVID does, we have to respond to the person's individual comfort level. So we have some instructors who say, no, I'm not teaching even if you're open. We have some that have said that, and then as they got used to the idea, they have readdressed their comfort level. And I think just accommodating, and we're able to do that because we're an independent organization, right? So we get to make the decisions in the office. I would like to hear from people who teach for universities, for instance, and things like that, but that's where we're at.
So in our case, sorry, Jiyong, you want to go first? Yeah.
No, you go ahead.
Okay. In our case, the school's been great in that they've asked each of the faculty members to think about what classes they could teach in the fall, how they would go about it. So instructors got the opportunity to say, I normally teach glass blowing. However, I'm high risk in this, and I don't think I should teach that class. Therefore, I could teach these other classes, and I would do them through these means. And so all the program coordinators kind of collected that, and assignments were sort of shifted around. Even now, actually, we're shifting things around. We're finalizing instructors because people are changed. Like people who said they weren't willing to do something are like, oh, we didn't realize we could do it this way. Or people who said, yes, we will do that. Now we're going, I don't feel so good. My dad just had a stroke. I need to take care of him. I really don't want to be whatever the circumstances are. I think we're all just looking to help each other out. We're all in this together, kind of, so I feel like, yeah, if my colleagues say they can't do something and I can teach that class and they can swap with me, great. At least that's how it's working in my school. We're just trying to figure it out internally so everyone's comfort levels are met as much as possible.
Yeah, I can agree with what Anjali says. It's very individual, and I think also we are trying to address this to every teacher, and in my team, we are looking at ways of teaching that the teachers feel comfortable, but also, of course, that we can teach adequately to what the students need. But we will also discuss this with the students, because I think it's very important that they know why we make certain decisions and why we might have 2 weeks of non-class before we start a certain class again. We have to see that we can arrange our time, but also be comfortable with what we can do in that time. So some of the teachers, they strictly stay online. Others, and especially in the workshop, you have to be there, of course. But then I'm asking, okay, what do you want? How do you feel most comfortable? We can put the students there and you can be on a distance assisting them. So this is what we're trying to do with banners and tables and chairs, just to seal off that area. But it's what Anjali says, it's a process, and we all have to get used to it while we're doing it in a way.
Thanks. Yeah. Oh, go ahead, Jiyong.
I think there'll be lots of people who are cautious about this issue and sensitive and scientific, but there can be people from the faculty have a completely different perspective. They think this is not matter, and it's not dangerous as much as people saying. So I think it's important that the faculty, the colleagues, have some common level, because I've seen other people saying completely different thing.
Yeah. So I just shared the poll results with everyone from the beginning, and it looks like the biggest concern, it sounds like, is basically what we've been talking about this entire time, is how to maintain cleanliness and safety in the studio while running classes. But I think, not surprisingly, a close second to that is, how do you operate, with this reduced capacity, whether you're a private studio or a public access studio. Maybe slightly less of a concern for the universities, but if you can only have 50% capacity, how do you make the numbers work? While doing that, when you're especially looking at increased costs related to cleaning, and I think everybody kind of talked about the staff is working triple time now. So I wanted to maybe, there is a question in the chat about virtual classes. And I think, anybody that has been doing anything that wants to share resources in the chat, links to what they're doing would be great from a virtual class standpoint. But I did maybe want to just open it up to the whole group. Is there anybody that's on the call that would like to unmute and chat that can talk about maybe something that they're doing at their studio that hasn't been mentioned yet that they'd like to share? We covered it all. Okay. Well, how about a different one then? Are there things that, oh, there's a question here. Oh, okay. Are there things that you've changed that you can see maintaining, post-pandemic, when we get to the kind of other side of this? Are there things that you've changed that will kind of stay with you in the studio, or do you imagine things going back to normal, quote unquote?
I think, we have discussed how once you start to think about all the ways that we share germs, and we all knew we were doing it all along, but now that we think about the fact that we share blowpipes and that our breath is trapped in those pipes in a way that's not just artful and beautiful, but also kind of gross, I don't imagine that that is going to be easy to forget. So I do think that, you know, the cleaning protocol is going to be something that people cling to for a long time. And I think, you know, in general, that's probably for the best.
Yeah, I agree. I just launched another poll, just curious how people are feeling about when you think you might reopen. Not reopen, sorry, but return to pre-pandemic levels. So even if you are currently open right now, when do you think that things will be back in terms of you're running at more full capacity in all different things? Give everyone.
2021 at the earliest, I would say. The way COVID moves and behaves in Europe is very unpredictable and could scare the hell out of you, really. It didn't come to a big second wave yet, but I think everybody's waiting for it, which means that the fall semester will be 50% at the most, and probably also the spring semester 2021. So if we're lucky, I would guess summer or fall 2021 might be pre-pandemic situation, but I think really only if we're lucky. There's another thing I also want to say. I think there's a big difference between the public studios and the commercial studios and the universal studios. The way that you have to treat your studio, your employees, your fellow workers or whatever is so much more difficult for those commercial studios. I feel my job is quite easy when I hear Brian talk about what they have to do to even get 20 people in that workshop. So much respect for that.
Thanks. Yeah, I just shared the poll results. It looks like most folks are thinking it's going to be a year from now, at least, or a little bit longer, next fall of 2021, before things are back to normal. And I think, you know, we're in it for the long haul. I know there was a couple questions. I promise we'll get back to virtual classes, which I saw come up in the chat again. But I was just curious, I'm sure there's some people on this call who have not reopened yet. And so the panelists who have reopened, would you be willing to share if there were anything that was unexpected or things you wish you'd known before you opened that happened in the weeks leading up to opening that you'd want to share with the group?
Mental health, we started talking about during the shutdown, but as a manager, you don't realize, I mean, you have to take care of your own mental health, but your employees' mental health, especially in New York, when you're asking somebody to get on a subway. And in the beginning, it wasn't too bad. It's starting to get a little more scary here now, just getting on the subway and getting to work. But just the thought process you have to go to actually to get somebody in the space and to be able to do their job. We went through last week a series of depression based on just, like I said, you're a month and a half in, and then you realize that what we're doing isn't as sustainable as you want it to be, and not knowing that next step. It was a surprise. I knew it was going to come, but I just didn't know when to expect it and how to deal with it quite right.
Yeah, we provided de-escalation training for our staff because, you know, we expected that it was possible that we could get people coming in who didn't want to wear a mask, who didn't want to maintain social distancing. And a lot of times the people that are the ones who have to deal with those kind of confrontations are your frontline staff members, the ones who, you know, are the first face you see when you walk in the door. And so how do you make sure, there was a lot of anxiety for those people around what do we do if something happens? How do we handle it if someone refuses to wear a mask? You know, and so that was a really important thing for us to do.
I think the thing that caught me off guard is that I think as someone who sends out the majority of the emails from Public Glass, I am used to people not reading them and asking me questions. But I think that like the universal anxiety that we all had made me believe people were going to be reading this carefully and come in with that knowledge. And we're still seeing people who are like, oh no, I didn't know any of that. I had no idea I was, and it's, we're all human. We all, miss things. But I think just the idea that we can't assume, like, I think it was Brian said, I'm not sure, but or Jiyong, that not everyone is taking this as seriously. I got an email this morning asking if we were having hot glass cold beer right now. And I was like, no. So I think it's surprising to have to still answer those things and harp on people about something that feels so life or death.
Yeah, I know we have so many signs in our building. I mean, we've been joking that like, when you first get there, there's a giant A-frame sign outside. There's a giant sign on the door. There's signs inside, trying to be as easy and user-friendly as possible. How to wear a mask in graphic pictures, instead of having to read lots of things. But it does feel overwhelming. You're trying to do all these things and you wonder how much are people reading? How much are they comprehending? And if they have already made up their mind, how much what you say matters, and that's a little bit scary.
Yeah, it's interesting. The same thing happened to us. We had a open studio meeting before we opened, just to explain our protocols, and a Zoom meeting just like this. And we were so used to, the entire staff was just focused on everything that was coming out in the, in the news, and you realize that people were not reading and looking at the news at that point. A lot of people just kind of were like, I'm gonna take this shutdown, I'm not gonna. So when we were talking about some of this information of things we're doing, we got a little bit of pushback because people weren't as informed as we thought they were going to be.
Yeah, definitely. I just saw a comment come up about people push back against masks. We talked about this a lot internally about what do you do if someone says that they have the inability to wear a mask. We decided that our step one, we definitely got a lot of advice saying that asking what people's health concerns was not a good idea. That's asking them to divulge private medical information in a public setting. So what we decided to do was have at our front desk face shields, clear face shields that we could offer to guests as an alternative. If wearing a mask is too prohibitive, that at least would be another option. We haven't had to offer that to anyone yet. So, and to be totally honest, if someone refuses to wear the face shield, we will allow them in, but we're really hoping that it doesn't get to that place because our staff feels really uncomfortable about that, and I don't blame them. We want to make sure that they're protected as well.
Actually, if I can, I made the comments. If I could weigh in for a sec. In conversation with staff, I think we're going to draw a different line. We're not a university. We are a nonprofit. We're a private business, and so I think we have that leeway to not let people participate if they refuse to mask. And I think some of this I've heard from folks like, I'm unable. I'm like, well, if you are unable, are you able to blow glass? This is a rigorous, respiratory intense activity. If the mask is an issue, why is glass blowing not an issue? Now, obviously that's not the same for flame shop or warm shop, but I get, Barbara said the same thing. It's about staff's comfort level and the risk that staff is taking showing up every day and dealing with a rotating cast of characters as the public comes in our doors. And, I feel like that's our first responsibility is if staff is willing to show up, then it's our responsibility to keep them safe. But we do have that leeway where some other places may not.
There was a question in the chat also about, I think this is more for universities. So someone from a university was asking for the university folks, like to know how people are allowing assistance if your administration is asking that everyone stay 6 feet apart. So I don't know, Anjali or Jiyong, I'm sure that's generally a campus-wide request that people social distance. How are you handling that in terms of the glass blowers or the folks in the studio?
They haven't really looked into our shop with a microscope or magnifying lens. That's why I'm trying to have my people wear masks all the time and face shield. You know, we're kind of taking extra caution. You know, while they're being in the shop, they don't have to be standing right next to it all the time. You know, they can step back and then step forward when they need the help. You know, minimize that close physical distance. That's all we can do. You know, they don't have to be like standing right next to each other at all time. And you know, so I think it will be helpful to minimize that the conversation, face-to-face conversation, before they enter the shop or before they start gathering. Discuss thoroughly what they have to do. So while they're in the shop, there's like less conversation. I'm sure, you know, it's like always, you know, unexpected thing happen while they're working, but at least they can put an effort to minimize that face-to-face conversation while they're working.
In our case, the school administration is very conscious of several processes, several programs like woodworking, metal, us, you know, just various programs where you do have less than 6 feet for some part of the process. And so we've been asked to identify all those areas. So so for example, if we're looking at glass blowing, potentially door opening, do you need your assistant to open the door? Or can you do it yourself? Or what else? You know, so we're breaking it down really finely and saying, okay, in these particular cases, we cannot find a 6-foot option, or no social, you know, we're not able to do that. So for less than 6 foot, more than 30-second transient sudden interactions, here's a list of what we can do. So we're doing like, I mean, the mask thing is just no mask, no access is sort of like what we're doing. This, I don't care if you're walking the corridor, you will wear a mask. Like it's not a, you don't have to do it here and you have to do it there kind of thing. That's just blanket. So it's mask, face shield, leather gloves, and sanitizer. So if, for example, you punty someone's piece up, you need to wear your own like baseball-y leather glove type things. You need to sanitize that. If you're going to put Kevlar gloves on top of that, it needs to go on top of that. You can't just stick your hands into Kevlar. So we've literally like broken down every part of every process to say, okay, what's before and what's after? Our biggest issue at this point is how are you going to remind students when they're doing it to do it consistently? That's where we're like, okay, let's see how September goes.
Yeah, I think it's like what you said earlier. It's about new habits, you know, trying to ingrain new habits in people, and it's tricky. There was a question about big public events, glass sales. I'm pretty sure Public Glass, Brynn, don't you guys usually do a big fall kind of pumpkin thing that is a big fundraiser? Have you guys decided how you're going to handle that, or?
We've done it once or twice. That's actually the Bay Area Glass Institute.
Okay,
They're kind of world renowned for that. It's incredible. I don't know what they're doing. I saw the executive director on the chat. I'm not sure if he's still here. We do a hot glass cold beer though every other month, and that is about it's a large portion of our income. Let's just say that. And without that, we're not really sure. You know, like Brian was saying, it's the unknown that's a little scary. We're considering doing a virtual one in October, but we don't really know. And I think that virtual engagement is something that we all have to adapt and try to bring in. We did just launch a product line. So I saw someone say, you know, we have online sales, and that's absolutely something that we're trying to lean into as well.
Yeah. Thanks. Sorry for mixing you up with Baggy. I knew it was San Francisco.
I'm honored that you think that we do that magnificent thing. It's brilliant.
But I think maybe that does bring us back. We have about another 10 minutes or so in the conversation to folks asking about virtual classes and virtual content. And I know everybody's kind of doing different things, and that I've read a lot of things about kind of virtual burnout and, you know, how much time can you spend on Zooms and in virtual tours of museums and in virtual classes. But I would be curious, beyond the panel, if other folks want to chime in about what they're doing in terms of virtual classes, virtual workshops, or ways to engage the public when they can't be in your building. We'd love to hear it.
Well, I can kind of touch on the virtual thing that we're doing with a group called Intermediate Skills Workshop. And I think that that's really what gives me a lot of pause about the hot shop, is that I don't know how you teach beginning glassblowing without physical proximity. But for intermediate students, we're doing those video lessons that I mentioned, and then hosting a virtual Zoom chat and actually having the teachers in the space, because that was a big challenge we couldn't quite get past. Was, yeah, you can ask questions about the video, but what if the angle wasn't quite right or it doesn't address that specific thing? So being able to have the teachers in the space and able to blow glass in front of the students on Zoom, which does require 2 instructors to videotape and then actually do, that's been successful for those intermediate students. But in terms of virtual programming for introduction, I have no way of knowing how to do that.
Barbara, I saw that you just put a note in the chat. Would you mind telling us a little bit more about what kinds of offerings you were putting up that you got so many wonderful views?
We actually didn't know how many views we were getting until we did the analysis at the end of June. So we were floored when we found out that over 20,000 people had seen our virtual programming during our complete shutdown. So we had different programming every day. It was the same thing every Monday. We had the same thing. Every Tuesday we had the same thing, but the content was different. We've cut it down now that we've opened our studios. So we have about 3 or 4 things a week because we just found that we engaged people so much. So it's been pretty incredible, actually. I also put into the chat that we had built out a portable hot shop that we could take out of Glassroots. It's not a mobile hot shop. It's by any means, but it can move out of the studios. And we've set that up in the driveway. And we've been trying to get some sponsorship to be able to take that out to some of the parks in Newark to get some additional public access to being able to see glass work. We would, do that at a distance from people, but it's just an idea that we had.
Yeah, that's great. I saw somebody asked in the chat, Liesl asked if people were working with their cities for access to public outdoor spaces. And in Pittsburgh, it's a challenge because our current regulation is still groups no more than 25 people, even outdoors. So, we have a mobile glass blowing unit, but the idea of taking it out right now doesn't make sense until larger groups are allowed to gather outside. I'm not sure what the regulations are in New York or San Francisco in terms of outdoor gatherings.
Can I ask a question of Barbara?
Oh, yeah.
The virtual program you're talking about, that's the free programming. That's not paid programming, right?
So that was all of our free programming from March through June. And so now we're trying to, I guess, monetize some of that by moving that into a hybrid program, Brian.
I'm glad to hear from Barbara Lynn from Water Street Glass in Benton Harbor. And we worked 2 years to get an outdoor studio that we wrote grants for with new equipment. And luckily we were able to use that for the past month and a half to practice on. And that has been good. We have a barrier. So we've been able to allow in Michigan people to be outside if they're masked up, if they stay behind the barrier. And we've found that we've had a lot of people coming to be able to see those live demos. And then we've been posting those as well. It's very difficult. I really appreciate that Gas and all of the panelists participated today because I feel like we've all been kind of holding our breath, waiting to say, what is everyone else doing? And it really has been very helpful to hear some of the other things that people are doing in terms of, are we doing the right things? Are we doing all the things we could be doing? So I'm glad that this is going to be available. The one question I did ask, and I'm just wondering what people are doing. We're a public access studio, and I went for 3 months without interacting other than Zoom with my staff. We finally are having outdoor staff meetings where we're spaced apart, and that has helped our mental health a lot. But are there some things that people are doing for that?
Thanks, Lynn. That's a great question because, you know, there's been so much uncertainty around jobs and around, you know, the toll of the pandemic on top of all the other tolls that are kind of going on with everyone. You know, I know for us, we've just been trying to check in lots, both through official channels and texts and phone calls and things like that. So I don't have any like amazing ideas to share, but I'd love to hear if anybody else has been doing anything. Somebody in the chat said lots of whiskey, which is definitely helpful.
We have had 3 months of virtual classes, which started off quite chaotically as we did not have any experience in how to use Zoom or any of the other platforms. So in a week's time, the teachers had to get used to it, and that introduced it to the students, which was a major task because some of the students left for their homes. They come from all over the world. Some were still away, and we told them just stay put where you are. So eventually the online classes worked really well. We all had to adjust our program. I was giving lectures rather than doing conversations and reflections with the students. But also what we learned at the Academy was that instead of just doing the lecture and just going through the techniques or the stuff they have to read, do something that's fun, be personal, ask them how they are, ask them what they've been eating. We've been doing quizzes, for example, which helps to just like be that community, be that group together, which I think is the most important for the students also, to feel that you still belong somewhere. So that would be my advice.
Well, we are kind of getting to the end here. Just a few minutes left, and I haven't actually asked Brandy about this yet, but I'm thinking that the answer will be yes. That if there's interest, that we have another one of these check-ins in 3 months, 6 months. It sounds like everybody believes that we're in this for the long haul. This is not going to be something solved before the end of the year. So if people found this conversation useful, you know, we can definitely try to schedule another conversation. And I guess one question I would have, and you can either put it in the chat or you can speak up and say, is there anything that you wished that we had covered or that we had talked about more that wasn't brought up today?
I think if I can just pipe in that I would be appreciative to have this monthly, just for the fact that things are changing so dramatically, so quickly that 3-6 months, I mean, we could be in a completely different, you know, form of life at that time. But I think it's very important that everybody addresses it, you know, disparities that are going on with the students at the university levels that are not able to access the work that they were able to do before. I mean, I'm a 20-year glassblower and a university student right now in the jewelry department, and we lost so many students and so many things have gone awry. So I think it's just really important, like he said, to check in on people's mental, you know, capacities and what they're eating. Because right now, like, as much as people wanted to focus on their practice, they basically have been trying to focus on how they're surviving. So, I mean, and survival for artists is a little bit more challenging, I think, than the rest. That's just me, but I really appreciate you guys all gathering today, including any of us. Thank you.
Yeah, thank you.
Appreciate a month.
More folks would like to talk more frequently.
A thought that could actually keep us all connected in between. What if we formed a Google group? So just a shared email channel that you know, anyone that wants to participate in can actually stay in contact and send their questions to the group as a whole. It's something that's come in really useful in a variety of formats for us, and I think that that would allow the distance between the Zoom sessions, whatever you guys decide that might be, to feel not quite so far.
Great.
And I'd also say at that point, I mean, maybe it's different in the city, but we are on so many different working groups. It does really help to talk to other people, whether or not you're seeing them in person or on a screen. But I know I'm on 3 or maybe 4 working groups at this point, even with the studio open.
Yeah. Great. Well, we are about at our hour and a half. I will definitely chat with Brandy about trying to get this group together more frequently, or other folks that maybe weren't able to join today as well. And please do spread the word that we will be posting this video on GAS's YouTube channel. So if you did have colleagues or folks that were hoping to join that weren't able to, you can direct them to that resource. Brandy, do you have anything else that you want to add before we sign off?
I will just say that we're hoping to have this up on our YouTube channel by Friday. We'll send out a social media notice so everybody knows when it's up and have the link to it. This was our first community conversation, but it is definitely not going to be our last. I know our original plan going into this is that we would meet quarterly on different topics, but it definitely looks like this may dominate our lives for a little bit longer. So I do think it is very reasonable for us to revisit this again, and possibly again after that, because we definitely have at least another year in front of us, if not more. I am just so happy to see you all, and thank you so much for coming and participating. The panelists, you were amazing, and I appreciate you all bringing your varied experience. And I think that was what was so important about this, is that we are all going through it, and everybody is handling it just a little bit differently. So it was great to hear so many different perspectives. So just thank you everybody for coming and for participating and sharing what you're doing, sharing your concerns, and we will keep talking for sure.
Great. All right. Well, thanks everybody. Bye.